I have a 14-year-old patient who has presented to the clinic with the chief complaint of small red itchy bumps on his arm with the duration of a year. He is originally from Mexico and has not received any health care and is currently uninsured. He presents with his mother. He is allergic to seafood, which produces tongue itching and rash. He currently lives with his mother and sister and denies tobacco, alcohol, or drug use. Review of systems is negative, except for skin-wise. He does state he has little red bumps and dry patches on his arms and legs, and that his skin pinches up between fingers when pinched. The occasional headache. He does have shortness of breath after activity and says that his chest is dented in. He also states that he gets tired after running around, and he does state that he has some lower abdominal pain on, and he also has a painful area on the left side of his penis, and he states that he has difficulty urinating. He says that his joints are really flexible and that they pop and crack when he moves. He also states that he feels like he is shorter than his friends. Upon my examination, I found a young male appearing his stated age with small red bumps on his upper arms and lower legs. Skin turgor is decreased. He does have microcephaly, low set ears. He has a really high palate, macrognathia and retrognathia, supple neck, full range of motion. His chest is caved in, as would be expected with pectus excavatum. Lung fields clear to auscultation. There is a murmur present upon auscultation, but pulses are equal bilaterally, and there is no bruits heard. He does have left lower quadrant tenderness upon palpation of his abdomen, and there is a left inguinal hernia and appears to be a left undescended testicle. He has hyperextension of his joints upon doing range of motion, and there is crepitus present. His fingers are really long and thin. Lordosis is present in his spine. Scoliosis is present. He is short for his age. But all cranial nerves are intact, and he has sensation in all extremities. My diagnosis is Ehlers-Danlos syndrome, so he's going to be referred to a geneticist and for therapy. And I also performed education that goes along with Ehlers-Danlos. He also has a diagnosis of micrognathia, retrognathia, scoliosis, pectus excavatum, crepitus, a heart murmur, an inguinal hernia, hydronephrosis, a undescended testes, and atopic dermatitis. He has a coordinating referrals to a cardiothoracic surgeon and a general surgeon to assess his chest and his scoliosis, as well as his hernia and undescended testes. I provided education on how to treat his atopic dermatitis with over-the-counter Cetaphil.